Hello, everyone, and welcome. Welcome today to this audio podcast. This audio podcast is part of the Chromulin series. This audio podcast as part of a Spectro integer, and this audio podcast as part of a Storm Lobostics production. Today, looking at Haematuria and sort of the research in around the research perspectives. As part of the part of the research perspective, as part of this clinical correlation publication from 2015. So haematuria is an important pathological finding, and thus is included in sort of criteria for chronic kidney disease. However, its presence is not usually mentioned in large epidemiological investigations when compared to other sort of when compared to other symptomologies. Most investigations in the specialty or within the field or within the specialty of acute kidney injury, for example, do not focus on the role of hematuria. A few investigations have described hematuria associated acute kidney injury in certain clinical investigations. So, for example, IgA nephropathy or warfarin-induced nephropathy, but it is difficult to apply data directly to subjects with a risk of AKI. And one investigation had demonstrated the associations of hematuria with both AKI, acute kidney injury, and mortality in an intensive care unit, an ICU recipient population, but concluded that further clinical and experimental investigations are required to delineate the role of hematuria in acute kidney injury. Other nephrology and urology research investigations suggest that had suggested there should be more pathways to point of care testing (POCT) to identify hematuria because of the sort of longer term implications. Evidence from a majority of investigations suggests that urinary investigations may provide a moderately useful indicator of the presence of hematuria. For example, through urinary dipstick investigations, which have been sort of representable investigations in the presence of hematuria, and this can be used in a general practitioner setting and environment. However, in the context in which urinary investigations sort of warrants particular consideration. Research indicates that simple detection of microhematuria cannot be considered a useful diagnostic investigation for the presence of significant underlying pathology or physiological predisposition. The absence of hematuria on a single urinary investigation cannot reasonably be used to rule out symptomatic recipients from further examination. However, there have been little or no data on the associations, for example, between repeat positive investigations, repeat positive investigations for hematuria and the presence of the disease or symptomology. So, the usefulness of urinary dipstick investigation in this context has remained problematic. There are relatively few trial-based data regarding the effectiveness of screening for hematuria to the general population to identify life-threatening pathologies. Confirmation of hematuria using confirmation of hematuria using microscopy remains a valid option, where further investigations are considered, as stored samples are theoretically subject to degradation. The practice of sending sending a voided urine sample taken in community, for example, for laboratory analysis of hematuria appears to be of questionable value, although such samples may still be helpful or useful to eliminate urinary tract infection, or UTI, as a cause of hematuria. There have been campaigns or awareness in amongst public public and medical communities, which can and have helped to sort of delay and perhaps even prevent the development of chronic kidney disease. And one example, one example of in around raising CKD, or chronic kidney disease awareness, has been through a social media platform, the social media platform, the Renal Patient Support Group, the RPSG. And many cases of CKD are left unrecognized, but the condition can be treated even at late stages, and so POCT, point of care testing, is always advantageous. That draws this audio podcast to a close. This audio podcast as part of the Chromulin series. This audio podcast as part of a Spectro integer, and this audio podcast as part of a Storm Robotics production.